Hello, my name is Natella Rackmanina. I'm a professor of pediatrics at the George Washington University in Washington, D.C., and a director of the HIV services at Children's National Medical Center. I also work as a senior technical advisor for the Elizabeth Glazier Pediatric AIDS Foundation in Washington, D.C. Today we are talking to you with some of the highlights and impressions from the CROI meeting in Seattle in March 2019. I'm thrilled to have with me a very good colleague and a friend from obstetric gynecology, Karoline, who will be covering issues related to women. Karoline, would you kindly introduce yourself?
Thank you, Natella. It's a pleasure to be here. My name is Karoline Aebi-Popp, and I'm an obstetrician gynecologist, and I'm working at the University Hospital in Bern in Switzerland. And my research focuses mainly on women issues in HIV.
So what we decided to do today is to have a conversation about some of the highlights, only highlights, there is much more to that, but some of the highlights of the CROI conference 2019 that are relevant to women's issue that Karoline will cover and to pediatrics that I will cover. So Karoline, let me start with you. What were the most prominent areas that caught your attention and some new findings and some new data, or maybe just even new perspectives on something we already know in regards of women's health that you take from this meeting with you home?
So there were a few topics that draw my attention, and first I want to raise the topic of contraception in HIV infected women, because women affected with HIV have a really high rate of unplanned pregnancies worldwide, and that puts them really at risk for unsafe abortion, but also is a risk for mother-to-child transmission of HIV. So contraception is an important topic, and we saw this in the presentations here at CROI 2019, that contraceptives might have drug-drug interaction with antiretroviral drugs, and this is of concern. So the topics were around the long-lasting reversible contraceptives like the IUD with levonorgestrel and the implant. So I think the main issues are the drug-drug interactions with women being on efavirenz, and this is really of concern, which may impact on the effectiveness of the contraceptive. So one thing of the researchers mentioned was that we could double or we could increase the dose of the progestin to make it safe. But one very interesting talk was about pharmacogenetics. That explains us why individual women react differently to this pharmacokinetics. So the metabolism is different in different women. So this may help in the future to adapt hormonal contraception better according to the antiretrovirals a woman has to take.
And obviously, being a pediatrician, I'm immediately trying to place it in the perspective of adolescent women who represent the majority of the infection globally. And for them, it's of most crucial relevance because currently, at least at this moment, efavirenz is the regimen that is around the preconception, or at least in non-pregnant women that we are talking about.
Yes.
Was there any data that was specifically focused on adolescent women, or we just will have to look at the older women for that?
Sometimes they're excluded, I have to say, but there was a study, interestingly, showing that younger women were very happy with the progestin intrauterine device because the copper IUD might lead to more pain and heavier bleeding. So actually the adherence was very good to the hormonal intrauterine device. And the other thing is, of course, it's the rollout, so the access to contraception in resource-limited settings. So this was an issue especially for the younger women, having access and lowering the prices to allow women to use such effective contraceptives.
And overall, I think we both saw here at the meeting that we continue still lack the truly integrated approach where HIV services are interlinked with family planning for those who are ready to plan the family, but truly with contraception access for young women when there is not really yet a true family planning, and it is just a matter of sexual and reproductive health and independence.
Yes. So that was one interesting topic. Another one I want to raise here is the pre-exposure prophylaxis. So there were really interesting data on pre-exposure prophylaxis used by women during pregnancy and breastfeeding to reduce their risk of HIV acquisition. But there's also an concern how to inform women that this is an effective strategy. And there was a study I remember from Chicago showing that only 30% of women heard about pre-exposure prophylaxis. So I think we as doctors are still have the duty to inform our patients, to educate them, and to motivate them to also to stick to these drugs for good adherence, which is crucial in pre-exposure prophylaxis.
Yeah, I agree with you. I also feel that a lot of emphasis with PrEP is placed on men who have sex with men, which is rightful so, especially for the country like United States, where the epidemic is driven by these populations. But women should not be forgotten. In the global landscape of epidemic, I believe women, that's where we really need to place the PrEP message quite higher compared to what we heard and you just cited here. On the pediatric end, I wanted to share some and then hear your opinions because we were attending both sessions together. I do think we've seen some very important highlights and also get your opinion on those. We definitely saw some data we've been really waiting to see. There were 2 integrase inhibitors data in pregnancy specifically, addressing the issues of pharmacokinetic and also issues of safety and outcome. One of the most important issues that we saw being addressed is the speed with which the viral suppression can occur during pregnancy. And there were particularly 2 studies. The protocol 1081 from IMPACT was presented yesterday, and dolutegravir study Dolphin 2 was presented as well, that both reported the use of the drugs in pregnancy. So could you comment, what were your impressions? I mean, safety data looked pretty good. I think we were all very encouraged on that.
Yes.
Would the speed with which virus comes down during pregnancy matter to you as obstetrician?
Yeah, that would really matter, and especially for women presenting late in pregnancy. So the integrase inhibitors have shown yesterday in the session that they really allow us to have a faster decline of the viral load. Then we want to go undetectable until delivery, and we don't know actually when the delivery takes place. So if it takes place preterm, we need really every week for treatment. So that's an issue.
I think we also saw yesterday that, particularly with Dolphin 2 study, independent of the regimen, and both studies compared raltegravir with efavirenz and dolutegravir with efavirenz.
Yeah.
But obviously we both saw that independent of the regimen, late identification of HIV in pregnancy or late start of treatment still is associated with poor outcomes.
Yes.
And would you comment on that?
Yes, the reports we had from infected children were mostly infected intrauterine. The tests after delivery showed early the infection. So I think we have to be as early as we can in antenatal care, and this is crucial.
Yeah, I agree. I also really was intrigued by the study findings on the significance of hepatitis B infection in mother. That particular study, HPTN 046 protocol, focused on the fact that the high viremia for hepatitis B or high amount of hepatitis B in the mother of the virus in association with HIV seems to have caused some worse outcomes in terms of birth, and also might be associated with increased risks of acquiring HIV by infants.
Yes.
That's finding, I think, is very preliminary. We need to have more data, but I do think we need to get more data on the HIV viral load in those women and really try to see whether we should be more vigilant in terms of managing hepatitis B, in particular high viremia in women who are co-infected with hepatitis B. Another study, Karoline, that I thought was very interesting for me is the study of broad neutralizing antibodies in young infants. And it was very encouraging to see the data by Colleen Cunningham and her collaborators that showed that it's feasible and safe to administer these antibodies to children as young as 1 day of life, which opens the perspective to introduce passive immunization with VRC01. It was long-acting, I believe, LS,
Yeah.
for the start right at birth in those infants.
That was very interesting.
Yeah, I think this was to me a really groundbreaking study because I think it sets up the whole new path of how we are going. And the plenary this morning, which was, I thought was fantastic, really talked about completely new modality, how we are going to prophylax children and treat possibly as well for those who are infected.
Yes, and the vaccine study is going back to because you can't transform them from the adult population to children. So this morning she actually said they start and do more research now also on the vaccines in the children.
And I really like for the adult physicians to start looking at the whole line along with pediatricians. I feel that vaccine unites us a bit more even than the antiretroviral therapy did, because we look at the whole lifespan from birth, looking at passive immunization in the first few years of life, moving to active immunization and preparing the young person for onset of sexual activity and protecting them prior to onset of sexual activity.
The whole lifespan just gives us the broad picture.
The more broad picture.
It's much better than separated to different stages and stuck to you.
Well, since we started talking about lifespan, I know I'm a pediatrician. I probably stopped somewhere around 25 years of age. And but I do know you are very interested and have followed some of the presentations in regards of women's aging with HIV. Is there anything you would like or could highlight for us?
Yeah, there was one interesting study actually about depression in aging women, and that treating depression was linked to worse cognition, and if you treat depression, actually you could improve this factor. And what came into my mind, are we really screening for depression if we see our patients? So first of all, that's important that we screen and we decide, is it menopausal issues, or is it real depression, and then we can treat it, and that is of great advantage for those women. And the menopause also shows it's a challenging time to adhere to your drugs, even if you were adherent the whole life. So that is an issue too, that we could really support those women and inform them, and if they have any issues that they really trust us to tell their issues around therapy. And I think this study was really good.
I think the screening issue comes across all ages. As you said, screening for mental health at menopause and aging women, screening for mental health in adolescents. I've also wanted to highlight that during CROI there are a couple of really strong sessions, and attention is brought up to mental health of the adolescents, adolescent women, adolescent men. Equally, I think, to neurocognitive development. What are the effects of the medications? We start dwelling more and more into the potential effects of HIV exposure, even in uninfected populations, on the neurocognitive development in children throughout their lifespan. So I think what you are putting up on the map is a more proactive approach by all healthcare sectors to the screening of women is really of importance. Overall, in closing, I feel, do you want to say a few more words about this CROI before we close our discussion?
I think it was a really interesting and thrilling conference so far, and it's amazing how many women are also present as researchers and community talking about women issues. I was really impressed, and I think it helps us going back and having good motivation to continue our research. So without those exchange of knowledge, and I think sometimes it can be more difficult, but I think everybody is inspired and motivated and about women's needs. Especially.
I also believe with you that women being so high are very important, and I really like to see what I see at this meeting is a continuity of women's health with a child's health. We've seen some really interesting debates and discussions about the relationship of ratio risk benefits, and we will carry more this discussion between maternal child health. But to me, the fact that we are continuing the discussion and there is really no division between women's health in terms of HIV and the child's protection and health, and there is a really good data emerging that will serve both populations at group. I'm coming also quite inspired from the meeting with an attention and focus placed on pediatrics as you with women, and I do think that events of the last year and the reassessment of the guidelines in the view of the risk factors have helped us to really raise both populations quite high on the map of HIV epidemic. Well, thank you very much for your discussion, and we hope that we were able to share with you some of our perspectives and highlights on women and children's health issues in light of HIV from CROI 219 in Seattle, March 2019.